Good afternoon, ladies and gentlemen. This is Dr. Mobi, and today we are honored with great guest from Pakistan, Dr. Waris Anwar. Let's welcome Dr. Waris Anwar. How are you, sir?
I'm fine, Dr. Moby. Thank you so much for inviting me just at your wonderful show.
Thank.
And I'm feeling honored to be with you and to talk to your audience and your listeners.
Okay, great. So, just for audience sake, I just want to tell them that Dr. Waris been recently awarded with great honor in hair transplant, and that we'll learn more about that. But also tell us about your journey with hair transplant. How did you end up with this field?
Actually, it's a very interesting journey. When I graduated from Allama Iqbal Medical College in 1996. After doing my house job, I joined Department of Dermatology as a trainee dermatologist for my fellowship program.
Mhm,
When I finished my training in dermatology, I was told by one of my very close friend and a colleague. He told me that there is a fellowship program in University of Miami, Florida, that is a guest fellowship. At that time, all these things were very new in dermatology, like Botox, fillers, all these laser hair removal, all these treatments were very new in Pakistan. So I
mhm,
was very much ambitious to learn all these new techniques.
mhm,
So I got admitted in University of Miami, Florida for my fellowship that is called guest fellowship. I went there. When I was working there, there was a professor, Dr. Cardell. He was professor of dermatology.
mhm,
One day during a ward round, I don't know how he asked me. He just asked me, Dr. Anwar, would you like to learn hair transplant? And I immediately responded with yes. Yes, Dr. Cardell. I am keen to learn hair transplant because at that time we had just heard about hair transplant. I have not seen anywhere in Pakistan. We
mhm,
were only just listened the name of hair transplant. So Dr. Cardell communicated with his fellow colleague that was Professor Emeritus Dr. Bernard Cohen. He
mhm,
had a private practice in Coral Gable, Miami. So
mhm,
he communicated that he got a fellow from Pakistan and he's keen to learn hair transplant. So he referred me to Dr. Bernard Cohen. So I started visiting his private clinic to learn hair transplant. So
mhm.
this is how my journey of hair transplant started.
Yeah, yeah, and that's been a very long and successful journey. Congratulations on that. And
Thank you
so,
so much.
thank you for coming to our show. Also, tell us, our audience. So, first of all, we'll learn about, there is a basic, of course, difference between men and women hair loss. But we'll just
Mhm.
talk about some general. What is for everybody to understand that hair has a cycle and goes through that. So, and there are normal changes which will happen with age, and then there
Yes,
are.
yes.
Tell us a little bit about.
Initially, I would like for a basic information that the hair we had on our head, these are the hair around about 100,000 to 150,000.
Mhm,
Everybody have 100,000 to 50,000 hair on his or her head.
mhm,
And these hair have a cycle of growth. We have three cycles: anagen, telogen, and catagen.
mhm,
Anagen is a growing phase,
mhm,
telogen is a resting phase, and catagen is a when you shed your hair.
mhm,
So at a mean time, every person has 85 to 90% of hair in growing stage, 5 to 10% in rest stage,
mhm,
and 5 to 2 to 5% in losing stage. When you lose your hair, basically you shed your hair.
mhm,
So if someone is losing 50 to 100 hair daily, so it's not something worrisome. It's not abnormal. It's totally normal because you lose your old hair and you start growing your new hair on replacing those old hairs. So it's quite normal if you are losing 50 to 100 hair daily. But if you start losing more than 100 hair and as a whole, you start feeling less volume on your head and your volume is decreasing, then you should worry. Now I come to the second part of your question, that what are the causes of hair loss in men and women?
Mm,
So men have different causes of hair loss and women have different.
mm,
So I would like to start from men
mm,
because men are more bald rather than female just lose their hair, they have a thinning, but they don't get bald like men.
mm,
So baldness is a major problem of men. So the hair loss, the most common cause of hair loss or baldness in men is male pattern baldness or androgenetic alopecia. Basically, it's inherited. You acquire it from your family, either from paternal side or a maternal side. So if you acquired those genes when you reached to puberty at the age of 18, you got testosterone circulation in your body. One of the byproducts of testosterone is DHT,
mm,
25 DHT,
mm,
dihydrotestosterone. That is the main culprit of the hair loss.
mm,
That DHT get its attachment to the root of your hair, that is hair bulb. It has a receptive side, and that is your genetic defect basically. Now, this is the point to understand. Those who lose their hair, they got those receptive sides at their hair bulb, and 25 DHT at your puberty get its attachment to those hair follicles and start losing your hair. So if someone is 18 and start losing hair, he should immediately visit his trichologist, dermatologist, or hair transplant surgeon. So this is the major cause other than in male accidents, burns, diseases, malnourishment, and all these are the causes. Now, I would like to come to the female part. Now, the female have God has protected them from gross baldness. They don't have a genetic predisposition, just like on the frontal area, the male got very, very, very rarely female got a, a total baldness on their head due to certain diseases, but they just got thinning. So the main cause for hair loss in telogen effluvium is the major cause in female hair loss. Telogen effluvium means you start losing your hair and thinning, and there are multiple causes of telogen effluvium which can cause telogen effluvium. Number one is any medical illness, any surgery in previous 3 to 6 months, any anxiety and stress. This is the common cause in 30s, very common in 30s. Female are female are exposed to certain stress factors and multiple stress factors. They got hair loss. And most important is, I would like to tell for my female audience that that is postpartum hair loss. That postpartum hair loss is when you are pregnant, your normal hair cycle is disturbed. You are no more losing your hair. And all those losing hair which you have, you supposed to lose, are not losing. And those hairs are in a resting stage. When pregnancy is over, baby is delivered, at the 4 month, when hormonal influx is reversed, everything is normal, then you suddenly start losing your hair. So these are the most common causes. Rest are another common cause in female when they start doing crash dieting. They stop eating everything. They just try to take up very few things. They start having deficiencies of vitamins, protein, lot of nutrients which are normally required at the hair follicle for their normal growth. So they start losing their hair. The rest of the causes are diseases, same as male, any injury, roadside accident, any burn like acid burn and anything like that. So these are the common causes of hair loss.
okay. So you were mentioning when somebody sees their hair volume is less, what things they can do at that time?
Whenever you start losing your hair, the first thing which you can do by yourself, prior to visiting your doctor or your trichologist or dermatologist is you have to uh, see what is causing your hair loss. Are you taking a healthy and balanced diet? This is the most important factor. If someone is taking healthy and balanced diet, second is exercise. You have to do exercise 5 days a week. Third one is your sound sleep at night for at least 8 hours, along with healthy sexual life. So these are the three basic factors you need to check when you start losing your hair. Basically, our hair and our skin is the final outcome of our health. If someone is healthy mentally and physically, he must have good skin and hair. If your health is compromised, either mental or physical, you start losing your hair.
Mm. So basically, what you're saying is, skin has all these blood vessels, of course, and they have these micro vessels and so forth. So if you have any vascular problems, it will also show up in the skin, and here are no different than rest of the body. So it's one of the major organs actually. So that's why it's everybody to understand that skin is very complex in that aspect. That
Yes, Dr. Mobi, you rightly pointed out that our skin is richly supplied by blood vessels, and all nutrients, all oxygens, and everything is delivered through these blood vessels. If you have any interference in this system, any problem in there, either it's by nutrients, either it's by some structural fault, some defect, by some burn, some surgery, some scar. So blood vessels are not delivering properly nutrients and all these things, then you have a chance to get your blood supply compromised and loss of hair.
so it's very important to take care of your overall health because it's gonna show up like many other
Yes,
organs. So this is one of the organs might be showing up later, but it will show up. So, but it's very important. Like for even sometime, people have high cholesterol, and we will see some of the cholesterol deposits, in certain part of skin. And
yes.
you were also saying about about the hair. Also one a few questions I have from audience. One is about shampoo use, and then also about washing.
Shampoo, basically, the purpose of shampoo is to wash your hair nicely, neatly, and clean it. So, if your shampoo is making a good lather and washing it properly, so it is doing its job. So it should be daily, hair should be daily wash. There is a myth. Most of the people have a myth that if we wash our hair daily, we will start losing our hair. So this is not correct.
Mhm.
If you keep your scalp neat and clean, it will give a better health to your hair. So if you got dandruff, then you need anti-dandruff shampoos. Otherwise, if your hair are normal, then you can use any good shampoo or conditioner for
Mhm.
washing your skin and hair. That's good. You can use it.
Hmm. So you don't have to buy expensive shampoos. Pretty much all of them do their job, and don't go into fancy things you might be allergic to. So how many times a week shampoo is adequate? Is every other day, once a day, or once a week?
I think the first part of your talk was you just mentioned that these fancy shampoos and all these things. All these are commercial things. Most of the shampoo companies would claim they got the ingredients. They are rarely get absorbed through skin. The most of the ingredients are not being absorbed through your scalp. So the sole purpose of the shampoo is just to clean your head and wash your hair. Very few ingredients are being absorbed through scalp. For example, there are many shampoos, many conditions like seborrhea. We prescribe for our patients antifungal shampoos. Those shampoos need to stay at your scalp for at least 10 to 15 minutes. You just have to apply those lotions or shampoos and let it stay for at least 10 to 15 minutes. So be so all those ingredients should do their job, a little bit absorption and killing the fungus and fungal organism over your scalp. So most of the ingredients are not being absorbed. So if you wash your hair daily, it's enough. And I fully recommend if you wash your head daily with shampoo and keep your uh, scalp and your hair uh, clean, it will definitely give good health to your skin and hair.
Mm. Okay. And is there any benefit of using certain oils on scalp?
It's a great myth of centuries old that hair basically improve the health of your hair. But the role of hair is just a massage. If you use oil for your to massage your scalp, it will definitely give you soothing effect. It's for soothing, number one. Number two, by massage, it will increase the blood circulation of your scalp. So it can help by increasing the blood circulation. And third one is grooming of your hair. If you apply an oil, it leaves a little bit moisture layer on your hair. So I would like to give an example. If you uh, paint your wall, it has nothing to do with the strength, excuse me, nothing to do with the strength of the wall, but it will leave a fancy layer on your wall, so it will look good. So basically, it's for grooming. So all these hairs are for grooming, for your soothing, and for your comfort.
Yep. So not much to do with actual methodology by which it can, but nutrition, health, diseases, health, sleep, better eating, and then comes the important topic about vitamins, which are and protein. We talked a little bit on that. So tell me in nutrition, specifically any vitamins they can take, or increase the protein or any other nutrients.
The
Very.
most, yes, this is very important question, Dr. Moby. Vitamin H, which is commonly known as the biotin, this is a very important ingredient for your hair growth.
Mhm.
So if you are taking biotin and along with the your protein like fish,
Mm,
chicken,
mm.
and your egg protein, these are very good for your hair. Basically, if you take all seasonal fruits, I always recommend my patients don't be so specific to choose your vitamins. Rather, if you take all those seasonal fruits, so it got everything in it. So you can have good hair, you can have good skin. All those seasonal fruits you should eat. You should have fish, chicken, and mutton in your in your weekly diet plan. So these things play a very vital role in the growth of your hair.
Mm. And of course, extreme of temperatures are very bad. Yeah, that for sure. If you blow dry or do those treatment, they will damage your hair.
Yes, Dr. Movi, very important question you have raised. There are two factors. Number one, we have to learn the difference between hair loss and hair damage. Hair loss is when you start losing from the root your hair, that is hair loss due to some disease, due to some deficiency, due to some genetic factor. There is something going on in your hair follicle or deep into the skin. And damages when by some grooming procedure, just like blow dries, just like again and again doing dyes and all these fancy procedures like straightening of your hair, permanent straightening, all these procedures basically all those people use chemicals, and those chemicals can damage your hair. And those extreme weathers can cause the dryness of your hair, and there is crack on the surface of the hair. When there are crack on the surface of hair, it can absorb water from those cracked surfaces, and it make your hair fragile. So the chances of damage increases and your hair become defragmented. So you should avoid that.
Okay. Also, now let's go to the some of the treatments. So, people who have some thinning going on, so they can kind of check out some of the causes if they're listening to our earlier conversation, and then avoid things which can damage. And of course, there are normal versus abnormal, and make sure the protein biotin you said is pretty good. So make sure you have enough biotin, yeah, or take supplements if you need to, right? And what about vitamin C, vitamin D?
Vitamin C is very good for skin. Vitamin E is good for skin and hair both. Vitamin D is basically required. If you have vitamin D deficiency, then you can start losing your hair. So vitamin D is an important vitamin as well for your hair.
Okay. And also for vitamin E is probably both ways. If you take too much, it is going to damage too. And vitamin E has to be just appropriate, right?
Yes, very right. True. I agree.
Okay. And so same stands for, let's talk a little bit about other treatments. So if somebody has lost more hair, and this then comes to scope of your services. So tell us about, and I will share this your website with the audience right now, so they can see what are the different treatments you offer for hair loss.
Actually, I am offering hair transplant, which is the prime
Uh-huh.
treatment for hair loss. That is, if you are bald,
Mhm.
I would like to give an idea to my audience that if you have your hair and you start losing, it is best time to start your medical treatment to save your hair loss. If you are losing your hair, then you
Mhm.
need to have oral and local application for to save those hair. There is a process of miniaturization. Process of miniaturization means your process is started and you will lose your hair. If process of miniaturization has started, then you should use local and oral application along with PRP.
Mhm.
PRP is a very good treatment. It is second line treatment. First line treatment is oral medication, that is a very famous finasteride along with minoxidil, and there are plenty of other now new added treatment which can stop your hair loss. Finasteride, minoxidil and other treatments. Second line treatment is PRP. You take blood of the patient, you centrifuge it, you separate the plasma along from the red blood cells. Then from the plasma, you get platelets and you break down those platelets to release the growth factors. And
Mhm.
those growth factors are being injected into your scalp at the hair root, hair bulb. So those growth factors give nourishment and growth factors start growing your hair. So this is the second line treatment. And if you have lost your hair, there are no hairs on your scalp, then you cannot grow back your hair other than one procedure, and that is your hair transplant. So I am doing hair transplant for last 18 years in Pakistan. I came back from United States of America in 2002 and 2003. I started my own private clinic with the name of Aesthetics. Now it is with the name of Dr. Waris Anwar Aesthetics. If you type Dr. Waris Anwar Aesthetics in Google, you will get my website and my all YouTube channel and everything. So I am a dermatologist as well. So my super specialty is hair transplant. So I am doing all those dermatology procedure as well, laser hair removal, Botox, fillers, all these modern techniques for facelift, that is tripolar facelift, HIFU, high intensity focal ultrasound, By this, you can have a younger look and tightening your face skin. Along with it, all other those electrocauteries and other treatments which are needed for skin.
Mm. Okay. So also tell us about, you said for hair transplant you do two types. One is,
Yes, for hair transplant, there are two techniques basically. One is follicular unit transplant, in which you take a strip from the back of the head, and that is called follicular unit transplant and technique. The
mm,
other is FUE, that
mm,
is called follicular unit excision technique. In this, you don't excise the strip, you just use different techniques like machines to get your hair follicle from back of the head by uh, less than 1 mm diameter. We use a punch with less than 1 mm diameter. By this punch, we get hair follicles, and we make a sides on the front area where there are no hair on the bald area. So we implant all those hair follicles which we took from back of the head to place on the front of bald area. So this is called follicular unit excision technique.
mm.
Nowadays, it's very famous. Follicular unit excision technique is very famous as there is no stitch, no cut on the back, a big linear cut. So people feel more comfortable and safe in this technique. So we use this technique for most of the majority of patients. My 90% patients are getting FUE from me.
So they're getting FUE. It's a
Yes.
lot of FUT. So if they have really lost a lot of hair follicle and they're not enough hair at the back, what are the other options they can have?
Yes, great question, Dr. Mobi. If someone is deficient of donor area, then we are doing body hair transplant. Our first priority is to take hair from back of the head. If that donor area is not sufficient, we can take from the beard. We can take hair from the first from the beard, from the preferable area is chin. Then we can utilize chest area, excuse me, and then rest of the body. And even then, if someone is not having any donor area, for example, alopecia areata is a disease in which patient loses his all hair. He can lose his scalp hair, he can lose his eyebrow. Then there is a new technique and technology that is scalp micropigmentation. We use that technique to mimic the hair. We create a dot on the scalp that is pigmentary dot. It looks like a stem of a hair. So it gives an impression that someone has shaved his head, but hair are there. He has shaved his head. So that is also a valuable technique for those who do not have donor area.
Okay. Also, I'd like to know some of these techniques are mostly for men or is it for also for females?
All these techniques are for women as well. If someone is have a density issue, we can do hair transplant for a female as well. But we try first medicine and PRP. If it's not working, then we can go for hair transplant as well. And scalp micropigmentation, SMP, it's a new technique and it's a very helping for density issues in female. So it's a very helpful for female. For my special message to all those people who have had previous bad surgeries and they have scars of those surgeries on their back of the head. So you can get SMP to cover those scars with SMP treatment. And for the female who have density issue, they can also get benefit of this SMP scalp micropigmentation.
Okay. Well, thank you. We have reached the end of the discussion. So, any final message? And also, would like to congratulate you for the great honor you had. And any final message or thoughts for the audience?
My final message to all my audience would be take care of your health. Hair and skin is the final outcome of your health. And I will again say, take a healthy lifestyle. Your health is very precious. Take a healthy and balanced diet, exercise for at least 5 times a week, and take a good sleep, at least 7 to 8 hours at night, to have good hair and good skin.
Okay. Well, thank you for coming to our show. It was great learning for myself as well as my audience. Take care and thank you once again. And give us feedback, Twitter, Facebook, whatever you like. Thank you. Thank you.
Thank you, Dr. Mobi, for inviting me. It's a great honor and pleasure for me to have a show with you and to deliver all this my suggestions and comments to my audience. Thank you so much, Dr. Mobi.
Thank you, sir. Thank you.
Welcome.